Good day, I'm Andrea Chisholm and this is your JIS News for Thursday, October 8. A comprehensive expansion plan is underway for the Soapberry Sewage Treatment Plant, which offloads wastewater from Kingston, St. Andrew and Portmore in St. Catherine. The plan is being executed by Central Wastewater Treatment Company Limited, operators of the plant. The company's general manager told a recent JIS think tank that the expansion would be done in phases.
Is a three-phase module actually. So phase 1 is the 18 million gallon. We go to a phase 2, which is an additional 18 million gallon, and phase 3, which is 18 million gallons. The total capacity would be 60 million gallons because that is what we estimate or our research has indicated would be the capacity needed to treat with wastewater within Kingston, St. Andrew and parts of St. Catherine.
Approximately $52 million was spent on phase 1 of the project, while $45 million will be spent on phase 2. The Health Ministry is insisting that there is currently no need to close every school that has been affected by the hand, foot and mouth disease. As at October 5, there were 438 cases of the disease within 144 schools.
I would like to point out that some schools have reported just 2 cases and some even a single case of the illness. With this in mind, Mr. Speaker, it would not have been practical for us to close every school that reported cases. In fact, the acceptable standard is to close where 10% or more of the school population is affected.
The Health Minister told Parliament, however, that the ministry would continue to monitor affected schools. Symptoms of the hand, foot and mouth disease include fever and blisters in the mouth or on the skin. Dr. Ferguson is urging parents to keep infected children at home and limit close contact such as hugging, kissing, or sharing eating utensils. Persons are also encouraged to wash their hands regularly, sanitize toys and frequently touched surfaces, and generally practice good hygiene. Government says the proposed prisoner transfer arrangement with the United Kingdom may be the only short-term solution to address the poor conditions in penal institutions given the country's tight fiscal space. National Security Minister Peter Bunting says the main reason for considering the proposal is to ease overcrowding and improve rehabilitation efforts in correctional institutions. At Wednesday's Jamaica House media briefing, he pointed out that 60% of inmates were between ages 18 and 35 and serving sentences from 3 months to 3 years.
That's not hardened criminals when you're looking at those sentences. Those persons may become hardened and bitter by the time they've completed their sentences in the conditions that we hold them under.
Minister Bunting's comments follow a proposal for Jamaica to accept £30.5 million from Britain to build a new prison and assist with rehabilitation efforts if Jamaicans in UK prisons get to finish their sentences in Jamaica. Those prisoners would have already been scheduled for deportation to the island. A special select committee of Parliament will decide if the proposal is feasible. Government is asserting that it has no intention of changing the current arrangements governing the use of the voter identification system. The statement comes amidst recommendations for a national ID system which carries demographic and other data that could help the police in their criminal investigations. National Security Minister Peter Bunting says while the current voter identification system carries such data, when it was being established, a commitment was given to only use it for electoral purposes. Minister Bunting adds that no administration can unilaterally change that policy. And finally, the United Nations Population Fund UNFPA has developed an integrated strategic framework to drive the reduction of adolescent pregnancy across the Caribbean. Director of the Sub-Regional Office Sheila Rousseau made the disclosure during a recent JIS think tank. She revealed that 20% of women in the region have had at least one child by the age of 19, with a considerable percentage of adolescent girls giving birth before the age of 15.
The goal of this framework is to reduce adolescent pregnancy by 20% by the year 2019.
The framework was developed in consultation with CARICOM member states and consists of 5 priority areas, namely access to responsive sexual reproductive health services, information and commodities, access to age-appropriate sexuality education, provision of parenting skills, developing social protection mechanisms for the prevention of all forms of violence against adolescent girls, and legal standards to prevent adolescent pregnancies. And that's it for JIS News today. I'm Andrea Chisholm. Thank you for watching.